So any no? Good. All right. Suye, there's no Zisuye in the Shenong Bentao Jing, but there's a little entry in the Mingyi Bielu. It talks about how it descends qi and eliminates cold center and things like that. The seeds are especially good at doing this, so not a whole lot of information. The only formula we use it in is in Bancha Hopo Tang, and it's a specialty herb. It's very specific for lung and trachea. It's very specific for pungent dispersing of the damp that is preventing the qi from descending, right? That's basically what this is. So it kind of does what Shengjiang does, but it does it more in the lungs, and it does it with less warmth like Shengjiang does. And it does it in a very special situation, like because the way we use it, at least, I mean, I don't know if I can make a blanket statement that it should always only be used for endogenic problems, but at least the way we use it is for endogenic conditions, like a condition not triggered by an external cold or an external damp contraction, right? So basically, the internal problem was one of purely emotional nature. Bancha Hopotang is a purely emotional problem, right? And worrying too much, overthinking things, and so forth, leading to the spleen's physiology failing, right? Leading to the production of damp, accumulation, not production of damp as much as failure of damp to metabolize, and then that then leads to the trapping of the qi of the lungs. So basically, stuckness of qi. And this damp and stuckness of qi manifests in the throat, on at the level of the trachea, right? So that's the only place where we use Zisuye. Now, with Bancha Hopotang, and I think I talked about that when we talked about Bancha, which is that it's not Suye that is the primary herb to treat the throat. It is Bancha that is the primary herb to treat the throat, right? And that's always a big thing that's being taught in the TCM curricula, is that they always blame Zisuye for the throat. I mean, Zisuye contributes, there's no question about it, but it contributes in the same way that the Senjiang contributes and the other herbs contribute, right? So again, Bancha is the main herb for the throat. There's a lot of formulas that use Bancha for the throat. Bancha San, Bancha Tang are the most obvious ones in the Shahanun. Bancha San and Bancha Tang are for the throat. Formulas with Bancha for the throat, very specifically. So Bancha is the main one that will open the throat. And we saw that when we read the entry on Bancha as well. It benefits the throat, right? There's no benefiting the throat here in Suye, right? So that's the difference. So not a whole lot of other, need to talk about this herb. There's not a whole lot of other things happening here. So it's a pungent herb because it works on damp, but mostly in relationship to the lung system. That's why I put it in the metal circle, but close to earth, right? That's kind of why I do it. Just like the Shigao and the Hanshui, I would have loved to put them actually in the metal circle because it feels like, oh yeah, they're very much Yangming metal related. But Zhang Dongjing says very clearly, Yangming disease is excess of the stomach domain. So he's really blaming the stomach because, of course, the stomach is, of the two Yangming organs, Yangming stomach, Yangming large intestine, the stomach elementally belongs to the damp earth of the center. So that's the one that also provides that moisture, and that's the moisture that gets damaged when you have a dryness problem, because the dryness problem is a lack of moisture. So that manifests through failure of the stomach's physiology, right? So so that's why I put Shigao and Hanshui still in the earth slice, but very close to metal because of that relationship there. This one I put in the metal slice, but very close to earth, right? So that's kind of where that comes from. Bancha Hopotang, Suye in Bancha Hopotang. Guandonghua. Guandonghua is, of course, a pure respiratory condition herb, right? There's no question about that. Guandonghua is used only once in only one formula in this system. It's used, more commonly in other formulas like outside of this system. The reason for it is that it has such a very specific lung function. It has a very specific pulmonary function, and the pulmonary function again is similar to the ginger function again. It is about pungent dispersal of moisture so that the qi can properly descend. Right? So that's kind of the theme of a lot of these herbs. I mean, we talked about chenpi as well, right? Proper dispersal of moisture, of damp, so that the qi can descend. Ginger, proper dispersal of damp so that the qi can descend, right? Suye, proper dispersal of damp so the qi can descend. Right? Because they are pungent herbs, they don't have an active descent. The descent is the effect of their proper functions, of their function of getting rid of what's blocking the descent. Right? That's the main thing. So, Guangdonghua, very specifically pungent, warm. It's for coughing and the scent of qi. It's for tendency to have panting a lot, for obstruction in the throat, like lots of phlegm in the throat, right? And so you can see very clearly why it is used in the formula Shegan Ma Huang Tang, right? Shegan Ma Huang Tang, it's the sound of a water bird in the throat. Right? Basically, that's a metaphor for wheezing. It's a metaphor for rattling water sounds that are trapped in your respiratory system, right? When you hear the sound like the woo, woo, the wheezing happening and the gurgling and all the water and, like with certain kind of pertussis and things like that, where it's really, really intense. I'm not saying you can only use this for pertussis. You can use this for a lot of things. But when it's really intense, when there's a lot of moisture trapped on the lungs, and it is not moisture that is necessarily like filling in from the bottom, which would be more of a water condition, right? Like it's not like this is like it's not like like people who have heart failure and lung emphysema and those kinds of things. That's different. That's the water overtaking the south. That's the north overtaking the south. This is not coming from the north. This is from the center. This is a damp condition, not a water condition, which is a little different, right? Of course, to make damp, you need water, but this is a room condition to accurately label it. I was looking at you, Lorraine, because, you're on me. And it's a room condition, not damp, because the word damp is actually used for externally contracted damp, right? But yes, it's a room condition. So it's different than just a water condition. Water is shui qi, right? So Shogan Ma Huang Tang is primary formula for cold room, very wet, very thick moisture that is very cold, that is on the lungs, trapping the airflow in the throat, a lot of phlegm on the chest, right, causing panting, coughing, difficult breathing, wheezing sounds, and so forth, right? So that is Shogan Ma Huang Tang. Very powerful formula to stop the cough. The other herb in here is ziwan, right? Ziwan is also a very strong herb to stop the cough reflex. So Guangdonghua and ziwan they almost go in unilaterally and they stop the cough reflex. And that's why, in my opinion, Zhangdongjing does not use them so lightly, right? You look at formulas like Zhisou-san, it's like, oh, stop the cough powder. I mean, they just throw anything in that formula that stops coughing. I mean, okay, well, that's easy, make a formula, oh, stop the itch formula. Every herb you can think of that stops itching, throw it in there. Hey, great, what a beautiful formula. Not, right? So, I mean, it's retarded, right? So, basically, you got to fix the mechanism. Like, what are you doing? Like, just throwing stuff in there, So, Guangdonghua and Ziwan, yes, they can stop coughing. Well, then why doesn't Zhangdongjing use them in Shaqinlongtang? Or why doesn't he put it in Ma Huang Tang? Or why doesn't he put it in those formulas? Don't those patterns have cough? Well, it's a different cough, and it's a matter of severity, of degree. How severe is it? Guangdonghua Ziwan, I don't know if you've played with these herbs. But if you take those herbs, you almost feel like, this is just my personal anecdotal experience, is like, it almost like sedates the cough reflex. It's almost like it just stills the cough reflex, and thank God that they're pungent and bitter in the sense that they can also take care of the moisture and the phlegm and stuff like that. But it just really shuts down the cough reflex, which is a very different thing. It's much more of a Jingwei approach as opposed to Shahan, which always just fixes the problem and then the symptom just goes away, right? The Shahan Lun just does not really care about the symptom. Symptom is that's just a cue. That's just like something that makes me think of the formula. That's just a piece of information that was, thank you very much, for telling me that while I fix the actual problem at hand, right? The Jingwei is different. The Jingwei is much more focused on the symptoms, and it uses much more symptomatic herbs, and this is one of them. So it's not something to be used lightly. I would never use Guangdonghua or Ziwan lightly. Also, if you go to a fight, you don't like show all your tricks on the first encounter. You don't. You don't take all your weapons to the fight. you just take a few things and see how it goes, and like you keep something back so that you can increase, you can escalate if necessary, right? So it's the same thing here. Like Shogan Mahwantang, you're escalating the treatment of the cough. This is taking it to the next level. Very, very strong formula. Yes.
Why does Zhang Chunjing use Xinjiang versus Ganjiang?
Why does Zhang Nongjing use Xinjiang versus Ganjiang? Because it's more dispersing. Did somebody say that? I think so, yeah. Exactly. It's more dispersing, yeah. So Ganjiang works on the qi layer. Xinjiang works on the water layer. Paojiang works on the blood layer, right? Paojiang stabilizes fluids and stabilizes blood, you know. Ganjiang warms the air and therefore dries the liquid. Xinjiang goes into the liquid and disperses the liquid. So normally it would be Ganjiang Wu Wei Zi if it's more due to cold. It's Shengjiang Wu Wei Zi when it's way more due to the damp, right? And then of course you can have, if it's due to water and cold, then it's Xinjiang and Ganjiang plus Wu Wei Zi, and that's Din Wu Tang modified. Right? Din Wu Tang plus Ganjiang Xixin Wu Wei Zi, right? Then you have Xinjiang and Ganjiang. Well, Dongdongjing actually adds them, right? Yeah, we substitute often, but Dongdongjing actually can adds them. So, right, so Guanhua is all about that cold room on the lungs. Only used once, so very much a specialty herb, what I normally call a specialty herb. Mm-hmm.
How does that difference between the cold room on the lungs that happens with the general tongue cough?
The etiology, the basic pathomechanism and etiology is profoundly different, right? This is a cold direct onto the lungs. Zhenwutang is just a cold that damaged the conformations that ultimately led to the deterioration at a deep level of Shaoyin, which then led to the stagnation of water, which then ultimately, that water then started acting as a pathogenic agent and started affecting the earth and the metal in the upper burner, right? So that's like a whole series of events. This is punched in the chest, right? Hopo Mahuantang, wind strike directly onto the lung. Shogun Mahuantang, cold strike directly onto the lung. Right, and that's the thing. Like people are like, well, you know, this on direct strike onto the organs. That's all talked about in the Jingui. Talked about in the Jingui and treated in the Jingui. Right, and if it's in the Shanghan, it comes through the conformations and it travels through a series of events where it deteriorates certain functions that ultimately can lead to also your respiratory function that deteriorates. So that's the difference. Yeah, I mean the pulse is profoundly different, right? I mean there's a different type of pulse. Right, Jiegang. Jiegang is used in both Shanghan and Jingui, right? Jiegang used in Shanghan is very specifically for the throat issue, right? Jiegang is in the Shanghan used very specifically for throat ache, like dry throat ache kind of situations. But it's not a Shaoyang throat ache, it's a Shaoyin throat ache, right? Which is different, right? So basically, it's not the ministerial fire flaring that is invading the throat. It's due to the dislodging of the imperial fire, which actually is still ministerial. Once it is dislodged, it's no longer imperial, right? I mean, you once were an emperor, but now you've been chased out of the palace. I'm sorry, dude, but you're no longer the emperor. I mean, we like Bill Clinton, but he's no longer the president, right? I mean, so we like him more now, but basically, once you've been dislodged, you are ministerial. Like your actions look ministerial. Right, you're no longer able to be imperial. It's just impossible. You might have access to, like, you can still go pretty deep into the inner sanctum of the empire, but you can never really sit on that throne anymore. And that's kind of the difference. So same thing. Once it flares, it comes from an imperial source, which means it's coming from heart-kidney axis, but once it leaves that axis, it's no longer heart-kidney axis, right? While ministerial fire, pure ministerial fire pathology, that comes from gallbladder pericardium. That's a different type of pathology. And that one has never been in the inner sanctum. That one has never been on the throne. It was just always ministerial. It's just now too much of it flaring. but it was always ministerial. It's never ever been imperial. Though it received its power from the emperor, it never was the emperor. You know what I mean? So that's a slight minute difference. Although in clinical presentation, it can be confusing. A Shaoyang sore throat versus a Shaoyin sore throat versus a Jueyin sore throat, it's a sore throat. Patient comes in, doctor, I got a sore throat. You have no idea. Just from that, you can't tell. You can't tell from the symptoms. The pulse is what gives it away. But you can't tell from the symptoms. I mean, that's the same. There's nothing there, right? That would put it set it apart. So Jiegeng is an herb that does very similar things to what basically the action was that I described of Shigao, right? It is able to disperse, it's pungent, it disperses and it nebulizes. It disperses and it nebulizes, right? So basically now you've had heat from I'm talking Jiegeng in the Shahanan perspective, right? Heat that was original imperial that has now dislodged and it has started floating away. It was imperial and it's dislodged, it started floating away, acts ministerial, and it hits the throat. Why? Well, fire, metal control cycle. Something's going to get hit. The intestines are going to get hit, or the throat is going to get hit. In Shaoyin, if the intestines get hit, and it's with some heat, but it's on the basis of a deficiency, but there's some heat, it's what formula? If you know that, I'm going to be very happy.
Shaoyin sore throat?
Shaoyin, in diarrhea, that has some heat. Tao Hua Tang. Oh! Tao Hua Tang, right? Tao Hua Tang is to the intestines what Jiegeng Tang is to the throat. Just like in Shaoyang disease, it's both Huang Qin Tang. Just like in Jueyin disease, the throat is Ma Huang Sheng Ma Tang and the intestines is Bai To Weng Tang. Same thing. Same thing. Isn't it beautiful? Like this whole, I just taught that new seminar that I had never taught before, which is the formula equivalency seminar. And I thought it was amazing. This is an example of that. Like, so what I would teach in the class is like, Jiegeng Tang is equivalent to Ta Hua Tang. And people would be like, what? Like, how is that equivalent? Because Jiegeng Tang is the Shaoyin disease for the imperial fire dislodging and attacking the throat, equivalent to Ta Hua Tang being Shaoyin disease with the imperial fire dislodging, therefore acting ministerial and attacking the intestines. Why does it attack the intestines? Fire, metal control cycle. It goes up or down. Just like Ma Huang Sheng Ma Tang is ministerial fire dislodging from within the blood, attacking the throat. Bai To Weng Tang, ministerial fire dislodging from within the blood, attacking the intestines for Jueyin disease. That's what we call formula equivalency. Therefore, Ma Huang Sheng Ma Tang is equivalent to Jiegeng Tang. Ma Huang Sheng Ma Tang, Jueyin sore throat, Jiegeng Tang, Shaoyin sore throat, which is equivalent to Huang Qin Tang, Shaoyang sore throat. You see? It's beautiful.
What was the third one?
Huang Qin Tang, Shaoyang sore throat. So that is the beauty of Dandongjing's system. The next paradigm we're not there yet. I first have a lot more homework to do with you guys before we get there. But that'll be one of the ways that you will then ultimately also be introduced to. It's just yet another lens through which to look at the formulas. And it is going to blow your mind. I was teaching all my students who've been taught for years by me, right? All my big guns were in the room. And they were all like, okay, I can't shut my brain off anymore. Like, once you grasped the system of looking at equivalency, all of a sudden, you see equivalencies everywhere. And that was what happened to me in the last 3 or 4 months when I was developing this seminar, is that I couldn't stop seeing equivalencies. All the time, I now see, oh my God, this formula is equivalent to that one. I never saw that in the past. But now that I've trained myself in looking at the formulas through that lens, all of a sudden I see relations between formulas that seemingly look completely unrelated, but clinically have something in common, that achieve the same goal through a different mechanism, right? Just like I just said, 3 patients come in with sore throat, 3 different formulas, but they're all 3 sore throats. Right, you know what I mean? Like that's, it's really awesome. So that's kind of an example of that just now. So, Jiegung is going to take the water of the north, nebulize it, but it's going to be a warm nebula because this is a yang deficiency sore throat. Yang deficiency sore throat. But I know the throat can be red, the throat can be hot, the throat can feel dry. Yes. Because of yang deficiency, the yang is not able to actually steam the fluids up that will go up and moisten the throat, which means the yang cannot keep the yin on the outside of itself. Therefore, the yin gets so cold, because the yang is no longer inside the yin gets so cold that the yin stays on the inside and the yang floats on the outside. So the yang floats on the outside, your throat is burning. The yin is on the inside, Shao Yin Yang deficiency on the interior. What Jiegung does, it grabs some of that water with its pungent dispersal lung activity, disperses that water, creates a nebula that is not hot, but it is definitely a little bit warm. It's not a cold nebula. It creates a warm nebula to moisten the throat. And therefore, effectively, puts yang back on the outside of yin. Puts yin back on the outside of yang. That's what Jiegung does. Right? If it is, there's another equivalent formula to Jiegung Tang, which is the pig skin decoction, Zhufu Tang. And the pig skin decoction, that then truly is a lack of water, because that's a yin tonic. Pig skin, pig is a water animal, right? Skin is lung. It's the fat, it's the nutritive, right? So that is, when you do pig skin decoction, you're just basically drinking bacon, right? It's great. To basically replenish the yin of the lungs, because it's still due to yang deficiency, don't get me wrong. The yang of the imperial fire that was weakened, unanchored, has been floating for so long now that actually it's been depleting the yin of your lungs. So just sending some water up there, it doesn't work anymore because the water has actually been depleted to a certain degree, in the lungs especially. So now you have to add nutritive. So you have to add moisture with pig skin, right? And then it nourishes the yin of the lungs again to contain the yang that's floating and to internalize it. So a very, very Shigao-like action, like when I talk about putting the yin on the outside of yang kind of a thing, right? But not Shigao, not trying to cool, like not trying to actually stop a fever, right? There's no fever in these situations, right? So very interesting stuff. Second thing is that it treats pain in the, the second thing that, I guess I didn't read this line. So it treats chest stuff, sharp pain like a knife, abdominal fullness, rumbling in the intestines, right? Fright and scare, those kinds of things, palpitations. The first function was this kind of throat function of Jiegung in the Shahanan. All the other functions of Jiegung are in the Jingui, right? One of the other functions of Jiegung in the Jingui is to eliminate pus, right? And when we look, I think I have them here, these formula called Painong Tang and Painong San, right? Painong San is more excessive, so it's just more about dispersal. Painong Tang is a bit more deficient, so there's also a bit of nourishment and moderation in the formula. But basically, you're going to pull pus from a wound, right? You're going to pull pus from a wound. It is not a formula that actually heals what is causing the abscess. That's important to know, right? It's not a formula, because otherwise, it helps heal the abscess in a Western medicine concept. It helps heal the abscess, but it is not necessarily, it's the one that washes the wound clean. Let's put it that way. It's not the one that is the primary function of which is to treat the infection, if there were such a thing as an infection in Chinese medicine. But so it's about the one that kind of heals the wound clean. So basically, it's like as if you're using a little bit of water of the kidneys and you're just kind of flushing the wound with a little bit of saline or something, like a little bit of like sterilized liquids, sterilized water to kind of get the wound clean, right? Because of course, if you have any type of abscess, so Jiegung, where would it treat abscesses? Anywhere related to Tai Yin Yang Ming, right? So could it treat an abscess of the small intestine? No, it can't, right? But it can treat skin, lung, stomach, large intestine, right? Because of course that relationship to Tai Yin Yang Ming, it has to be from those types of tissues, right? So basically, it'll kind of pull pus and from those areas and wash the wound clean. And so then when you then wash it clean, then it can close off. And so that's something that you would use then when the major inflammation is kind of over, and then you use that to get rid of residual pus, basically, to help heal the wound. And that's kind of how we use it, right? So even in the lung abscess, like Jiegung Tang, also sometimes called Jiegung Gancao Tang, those two herbs, is also used in lung abscess, as you see here in this Jingui chapter 7 line. So it's very clear that it's about, there was all this heat in the body, right? And when you were in the stage of all this heat is trapped and producing this pus, and all the fluids are changing into a viscous state, and there's bleeding happening and things like that. In that state, when you needed to clear heat and drive those sticky fluids from the lungs, then you were basically using like Tingli Da Zao Xie Fei Tang or those kinds of formulas, right? But once the actual wounds, the abscesses rupture, which means they bleed, then actually the heat drops down. Like pneumonia going into pulmonary abscess, the fevers are a lot higher when the actual abscesses haven't really drained yet. Once they start draining and the pus starts flowing, the fever goes down. Because it's like a hollow organ, right? If the blood vessels are extraordinary hollow organs, when they start draining, they open, the temperature drops. When you bleed, your temperature drops, right? Ma Huang Tang pattern, high fever, you get a bloody nose, fever goes away, right? This is the only time when you're allowed to punch your patient in the face. Therapeutic. And so basically then the fever goes away because it's not bottled up, it's not pent up, so the same thing. So then what do? You use Jiegung Tang, simple as that. To do what? To pull the pus, just pull it out. Pull it out because that's the only way you're gonna heal it, right? So it's after the stage of we call that, in Chinese we call it Cheng Yong Qi. It's like the formation stage of the abscess. And then you got the Kui Yong Qi, which is the suppurative, like the expelling phase, like when the pus is actually expelling. So in the Kui Yong Qi, in the phase of when it's broken open, that's when then you just help it come out, right? Because it's about a hollow space that needs to be rendered hollow again. Like, so just get it all out. Right? Same thing with like something that's, if it's open, well then what are you going to do? Try to close it off? And no, you then just let it come out. Because then there's stuff in there that shouldn't be in there. You just let it come out. Right? So that's when you use the Jiegung phase. But then the heat is down, the fever is down, the main infection is way down. Right? So that's the difference there. So that's how it's used. And then it's also used in Juye Tang, and in Juye Tang it is basically for the same thing, to bring kidney water to the lungs, to cool the lungs, but you got to figure out why the lungs were heating up. And the reason why the lungs were heating up, which is the skin heating up, the face heating up, the lungs heating up, right, is because dislodged yang of the emperor. So imperial fire is weak, the anchor breaks, the yang floats to the skin, the yang flows to the lungs, the yang flows to the face, redness in the face, sweating, panting, but due to yang deficiency. However, the heat that's now in the lungs, it's your own yang, but unfortunately, it is still acting as a drying, heating up agent. So you still have to cool it off. So Juye cools off deficiency heat floating to the lung, right? And then Gegun cools off the metal. And Jiegung moistens the metal, but with a slightly warm nebula, not a cold nebula, because otherwise you would have to use Shigao again, which is not present in Juye Tang, because it looks like a Shigao type of heat, Yangming heat, red face, sweating, panting, right? You're like, oh, that's Yangming. No, it's not. It's yang deficiency floating outward, right? So that's why in Juye Tang you've got Fuzi, right? So that's the other one. So Jiegang again helps to go to the lungs and kind of opens the lungs, because only when you open the lung can cool off a bit, but it's cooling off just because you're letting a little bit of outside air in, and then you put some moisture inside. So that's basically that. Yeah, and that's kind of just Jiegang here. So Todo puts it pretty clearly. He says, turbid spit and pus and swelling, and then on the side it treats a bit of throat ache, and that's basically summed up right there. That's exactly what it does. Right.
So, Arno, can you differentiate the symptomatic presentation of a Taiyang, Xiaoyang, Shaoyin, Jueyin type sore throat? Or is there like a different area of it, a different kind of...
Xiaoyang tends to be more on the sides of the throat. Like Xiaoyang sore throats hit from the side, because Xiaoyang is the in-between positions, right? So it's coming from southeast, east-southeast, so from that direction, or it's coming from southwest, west-southwest from that direction, depending on what you're combining it with. But it's coming more from the sides with Xiaoyang throat. So it's more here, the sides, lymph nodes that swell up, and then this piercing pain, if it's bad, piercing pain into the inside of your ear. So it's like this is connected. Well, it is, right? This is hurting, like from here to here. That's typical Xiaoyang sore throat. Shaoyin sore throat or Yangming sore throat, but Yangming sore throat is basically a Yangming drying out of the throat. You see that a lot when you have a lot of postnasal drip, and it comes into your throat, and your throat hurts because of that, because it's raw. Or you have a heat strike straight onto Yangming, which is, for example, or wind strike straight onto Yangming, which is like fever school territory. Then the sore throat is straight in the middle, because that's coming from the south, right? That it's fire invading metal, boom, straight from the south, right? I'm not really sure about Shaoyin. Strictly speaking, Shaoyin sore throat should also be in the middle of the throat. It's more central, not coming from the sides. Jueyin sore throat should actually be coming from the sides, because of course it has that wood eastern in between direction relationship. However, the biggest thing about Jueyin sore throat is the fact that it has the formation of ulcers. Right? It has actual lesions in the throat, while the other ones don't have lesions per se. This is all very black and white. In clinic, it's much more diffuse, right? Shaoyang, Jueyin, Shaoyin. Well, there is no Taiyang sore throat. Taiyang doesn't have a sore throat. Taiyang sore throat is treated through Shaoyang. That's Huangqin Tang, right? So that's still sideways, yeah. Taiyang, because Taiyang is from the back, so it can't hit your throat from the back. So there's no direct hit onto the throat from Taiyang. And Taiyin doesn't really have a sore throat except for nutritive insufficiency of the center. Then it has a dry throat, and then it's again the center of the throat, and that's more like a Xiaojianzong Tang dry throat. It's not really an achy throat, it's more of a dry throat. And that's the Xiaojianzong Tang type.
Achy throat?
Dry throat. It's not really an achy throat, it's more of a dry throat. But as far as the patient is concerned, they have it hard differentiating between a throat ache, a dry throat, a scratchy throat. Especially when they say scratchy throat. Like, does that mean painful or does that mean dry? Like, what is that? And the same thing for me. If I have it, I also wouldn't really know what to call it. So if it bothers your throat, for me, it's either dry throat or sore throat. Doesn't really matter. I'll treat it as such. Yeah. Tinglizi. Tinglizi is one of the herbs. There's not many herbs that are mentioned to have two flavors, right? Tinglizi is one of the herbs that is mentioned with two flavors. Basically, pungent and bitter and cold. Now, Tinglizi, I should just let me look at the handout real quick so I can pull up that other chart so I can look at the chart at the same time. There we go. Over here. So with Tinglizi, we're coming into the water circle, right? Whoa. And therefore, so this was all, you can see all of this was metal. The reason why I put Jiegung closer to water element is because it's used a lot to actually nebulize fluids from Shaoyin in yang deficiency situations. That's why I put Jiegung a little bit closer to the metals, to water slice, right? And then we skip from the metal slice into the water slice. And now Tinglizi is used for the chest a lot. It's used a lot for pulmonary situations. However, it's used for pulmonary situations when there's a water involvement, right? And because it's a room formula, it's a formula that talks about water on the lungs. But it's hot water on the lungs. And it is no longer hot air that is heating up the water, but they're still kind of sitting distinctly in different places. They're sitting there together, but they're not yet mixed. Now it is mixed. So it is just hot water. The formula like Tingli Da Zao Xie Fei Tang is a hot water. It's a hot room, hot poking room on the lung. Difficulty taking deep breaths, inability to lay down flat at night. Also, sound of a water bird in your throat. But now it's a warm bird, not a cold bird. Right? That's the difference. So it's warm water leading to bird sounds, not cold water leading to bird sounds. So Tinglizi is going to be an herb that drains liquids. It's an herb that treats liquids, right? So let me go back to full screen mode here. It is not used in the Shahanlun. It is only used in the Jingui. It is one of the rare herbs in the Sheneng Bentao Jing that has two flavors mentioned. One flavor is pungent because it's about dispersal to allow for descent. But secondary flavor is bitter, which means active descent. I'm going to disperse and clear a path, but I'm also going to grab and yank down. That's basically what it's going to be, right? So it's very strong descending. And because it works on water, it is also used as a diuretic. But it is used as a diuretic in the relationship, working on the relationship between lung and bladder. And what's the relationship between lung and bladder? It is 同条水道下属膀胱, like it opens and regulates the waterways and it connects downward or transports downward to the bladder. And that's the relationship that Tinglizi embodies. Tinglizi is all about that. Tinglizi is about opening the lung, descending the descent of the mixture of air and fluids, which means just warm fluids, descending them into the bladder, which is of course the funnel at the bottom of your body. Your triple burner, it's like a vat. It's got an opening at the top, right? And then it's like a big vat, and then it descends into a funnel type of shape. That's how your body basically is, if you think about it. It's like a funnel at the bottom, right? And there's two exits. Well, two exits. Just like at the top, there's two entries, trachea and esophagus, and there's two exits, right? Front and back yin, as we call it in Chinese medicine, right? So it's like a funnel. So it brings the fluids down into the liquid exit, down and out through the liquid exit, right? That's the mechanism here. So it's kind of has this lung-bladder relationship, right? So a lot of the diuretics that we normally use are just about you tonify the spleen and you strengthen the earth water control cycle. This is not this type of diuretic. This is one that actively clears a path and actively pulls down with a bitter descending quality. And as it does that, it cools those liquids off as they descend. And that is crucial because otherwise you end up with having a lot of warm water stuck at the bottom. So it's cooling those liquids off as they descend, right? It's descending the liquids and cooling them off. So by the time they get into the bladder, they are cool, because a liquid that is warm is a liquid that is sticky. And a liquid that is sticky clings to the walls of the hollow spaces it is contained in, and therefore does not flow naturally under the force of gravity. The body doesn't pump liquids down. Gravity allows liquids to descend in the body. Liquids are only pumped up in the body, never down. Down is just gravity. It's like free fall, right? But up is when you start to have to pump it. That's why it's contained in a vascular system, right? So the descent, it has to cool off, right? This is important. I was just thinking about that the other day, because I'm gradually, I posted on Facebook a while ago, like I've been working on the advanced sequence, and I've been talking about the advanced sequence for years, but I finally started working on it, because we're starting to have like a body of people who are now finished with the training, and gradually there's still things that I need to say, not because I don't have enough work in my life, but there's still things that need to be conveyed. And basically, one of the things is going to be working on more physiology as well, because ultimately what I've noticed in now doing these years of delivering this type of training is that I need to weave the introduction to the classical view on physiology into the existing courses, which slows down the actual delivery of the material at hand, often leading to me not finishing my handouts. Often as in always. And so so I think I'm going to develop one, maybe two, depending on how much material I end up with, physiology weekends that precede the whole lot, right? And I know you're going to be like, well, we should have had this before. Well, it's true, but you're not alone. There's a lot of people who are going to say this. So, I'm just kind of flying by the seat of my pants here. I was telling Andre yesterday, it all started with me designing one weekend, and it wasn't even even thinking about doing seminars and taking this stuff on the road and developing an institute around it. No, it was just like for my students. I'm like, oh yeah, let me tell them some things, and organize the material. And in the meantime, it's become this Frankensteinian beast on me. But one of the things is going to be to talk about that, and one of the things is that warmth, yang, descends. And as it descends, it cools off, right? So qi and water are one thing, yang and blood, yin and yang. So when something is on the top, it's really hot, right? And then it comes down, and as it descends, gradually, it cools off. I mean, think of the rays of the sun. Thank God they cool off a bit by the time they reach us. Right, other people poof, right? The yin going up is cold at the bottom, and gradually, as it gets closer to the sun, warms up. That's the normal thing. That's exactly, yin goes up, yang goes down, right? So the blood that flows back to the heart assumes the color of cold. It's hypoxic blood. It's darker, more purple, bluish, right? It's hypoxic. And as it then reaches the top, it becomes red again, which means that it's infused with yang again, and then that flows down again. So the blood, because blood and qi and air, they all go up and down. But symbolically we say, oh, only blood goes up and only qi comes down. But actually, that's not really true, really, in the body. But there's different types of blood going up, going down. The blood that flows down like this is warm, oxygenated blood, and that's why we call it yang. Right? It's a yang activity, a yang thing. But the blood that goes up is a yin thing, right? It's cold blood, it's hypoxic, it's blue, right? So it goes up. And the reason why it goes up is because it has no yang, so yin rebels against the south. And yang rules the north, right? The yang of the south rules the north, right? In the same fashion, the qi on top has to cool off to come down. It cools off as it comes down. Or no, how? How does water cool off? The water on top is so hot, it's not even in water form. It's a gas. So it has to cool off a bit and turn into a water form, and then it can flow down. And as it flows down and reaches the north, thank God it's not boiling water, because it would burn your kidneys, right? So it comes, by the time it reaches the north, it's at perfect temperature. Right? So your urine should be warm. It shouldn't be too hot, but it should be warm. Right? Cold urine means there's not enough yang in the bottom, right? So that's the whole mechanism, right? So warm qi goes up. Pardon me, cold qi reverts back up, like we have in a lot of types of pathologies, right? Taiyin, vomiting, nausea. That's like all cold air and cold moisture rising up, as opposed to warm air, warm moisture coming down. Just like cold blood moving back up, warm blood moving down, right? That's the basic mechanism of the physiology. So part of that is going to be all. I'm going to put that all in this in the courses. Like there's going to be a chapter on blood physiology, qi and fluid physiology, those kinds of things, right? So. But from just to fit the system, like just what you need to know to fit the system, right? Now it's just kind of interwoven in all the courses. But this is definitely, this herb Ting Li embodies the descent of air, gases, and liquids mixed, right? That are too warm because and therefore they're sticky, and therefore they're not descending. They're sticky, they're clingy, right? So you cool them off. As you pull them down, you gradually cool them off. Right? So as you take Ting Li, for a little bit, you'll have some more darker urine come out, and then ultimately the urine will turn clear. The moment that the urine turns clear is the moment you know that the heat has been cleared. Is the moment you know you no longer need Ting Li. You don't ever want to use Ting Li on a cold lung. You don't ever want to use Ting Li on a cold urine. It's the wrong temperature because it cools off the fluid even more as it descends it. Right? So that's the thing. So Ting Li is used for the lung and it's used for the bladder, right? So let's have a look. Mingyi Bielu, does it say anything interesting? Well, yeah, it descends the water from the bladder, gets rid of hot air, water stuck in the skin, facial swelling, facial edema, even could treat itching. If you take it for long periods of time, it will make people deficient. It's a harsh herb, right? I've never seen Dr. Zheng prescribe Ting Li Da Zha Xie Fei Tang. Why not? Because when his sister just started studying with Dr. Tian, and Dr. Zheng did not even know medicine yet, he once had a bronchitis. And then his sister like, oh, I can fix that. And she gave him Ting Li Da Zha Xie Fei Tang and totally messed him up. And ever since, he's just had this aversion to Ting Li Da Zha Xie Fei Tang. So he's like, oh no, this is way too harsh. It's way too harsh. So, of course, if you have so much heat that it's now stuck in your liquids and you are developing sticky liquids that ultimately will cause abscess in your lungs, I mean, you have to use Ting Li Da Zha Xie Fei Tang. There's no question about it. Right? But don't use it lightly, right? So it treats water disease. Todo, thank you so much for your brevity. It treats lung abscess and chest bind, right? Because those hot liquids are stuck in the lungs. So Ting Li Da Zha Xie Fei Tang will drive liquids from the chest that are hot, and the heat is in the liquids, right? Da Xian Xiong Tang also drives liquids from the chest that are hot, right? So what's the difference? I would say that the difference is that Ting Li, not just Ting Li Da Zha Xie Fei Tang, there's Ting Li has more emphasis on liquids. Da Xian Xiong Tang still has definitely more emphasis on heat. It is much more of a febrile condition. Da Xian Xiong Tang is triggered by an external invasion. Ting Li Da Zha Xie Fei Tang is not triggered by an external invasion. That's the difference, right? So again, Jingui diseases can still be triggered by an external invasion, just not within the last 12 days. Right? 12 days, just 2 tours around the 6 confirmation, merry-go-round, right? That's all still within the Shanghan. Beyond that, you're in Jingui territory. So in the initial stages, you're, let's say you do have liquids on the lung. You're doing Yuebi, you're doing Da Qinglong, you're doing that kind of stuff. Even Shenxiong, Da Shao Shenxiong if you have to. But you're not doing Ting Li Da Zha Xie Fei. That's just wrong. If you start with that, and the patient has only been sick for 2 or 3 days, that's wrong. That is not accurate. Lung abscess, panting, inability to lay down, Ting Li Da Zha Xie Fei Tang, lung abscess, blah, 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 Ting Li Da Zha Xie Fei Tang, poking room with inability to breathe, Ting Li Da Zha Xie Fei Tang, water in your chest, like pleuritis, emphysema, but due to heat conditions, pulmonary abscess, pneumonia, whatever, those kind of things are all possible. And then a diuretic formula with Tinglizi in it is Muli Zexie San. And Muli Zexie San, water qi below the waist means swelling below the waist after great illness has resolved, which means that you've had a febrile event for a long period of time. There's liquids, your yang is still weak, there's liquids stuck below the waist. The liquids are still a little bit warm, residually warm. Because they are residually warm, there's a little bit of heat inside the liquids. That's why the liquids are sticky, a little bit sticky. That's why you need to soften the liquids. That's why there's muli in here. So you're using a lot of salty diuretics, right? Muli, zexie, haizao. You're using heat clearing like tianhuafen, which is gualo gun. Gualo gun takes the heat out of the liquid, right? Tianhuafen clears the heat that is now stuck in the liquid. Tinglizi drains that liquid, right? Remember the Muli Tianhuafen combination, right? This Gualo Muli San is in here, right? Yes?
Would you use that dosage of Muli as 9 or 30? How would you distinguish?
This is difficult. I don't know. I mean, I've used Muli. If I'm trying to soften something, I go high. If I'm trying to connect heart and kidney, I feel that if I go too low, it doesn't give me the desired result. I haven't systematically done any type of systematic research with my own patients is how many grams can I achieve one? I haven't done that. So my tendency would say to go higher, because it's my experience that you need to go higher. But with Gualo Mulisan, when you're using it as a diuretic, which is the same principle here, I tend to stay around the 12, 15, from 9 to 15 gram range on the Muli, yeah. So it's hard to say. But for the anchoring of the young, I tend to go higher. Yeah. It's difficult. I hate dosaging. I hate just this, like, it's very difficult to figure out. I mean, it's easy to figure out. You just need time and lots of patience. And patience, right? Just to observe the differences, right? I mean, it's like Huang Qi. Like one of my Australian students, Graham, he's a very good herbalist, and he's, he just uses like Gui Zhi Jia Huang Qi Tang or those formulas, Huang Qi Tang, uses it with Huang Qi at the normal regular dose, and like 9 grams or whatever, and it works just fine. And I've always had this tendency to go higher on Huang Qi. So I'm like, oh yeah, he's been doing it at low dose and it works fine for him. So maybe I should just try it at low dose and see. Maybe that's just fine, like, just because we've been. I mean, at least I speak for myself. Let me, it's just like you hear of formulas like Buyang Huan Wu Tang, and it's like 120 grams of Huang Qi, and you take a bit more of a material approach. And Huang Qi Zhenzong Tang in the actual book is only 4.5 grams of Huang Qi. But clinically, I don't ever see anybody use that low. I mean, normally we've always seen people use, my teacher always used 30, right? So I've just kind of adopted that without kind of questioning it. It works, but hey, maybe it would work even with less. So I just would have to do a little bit more of a systematic trying it out on a number of patients and seeing what the results are like, right? Even the Dangui Bushui Tang is this whole, 5-to-1 ratio, right? So it's also higher on the Huang Qi than. So yeah, it's kind of interesting. Well, I don't really know why the high dose. Is it just because the quality of the herb has gotten worse compared to the old times? I mean, I tend to think things older are better, but I don't know that. I have no evidence to that effect, right? So, yeah, still a lot of work to be done. Shanglu Gen. I don't have Shanglu Gen. Do you have Shanglu Gen? I don't have it, so I haven't really used it. So normally, the way I normally do this formula, Su Qi, same thing here. What I've been doing with Muli Zexie-san is I've just done Muli Zexie Haizao Tianhuafen Tinglizi and Fuzi. Kind of using the same kind of Su Qi, like in Guizi Chu Xiao Jia Su Qi Longo Muli Joni Tang, like using Fuzi there, kind of the same way, using Fuzi. It's a totally different herb, apparently. Obviously, with different activities, but it is about bringing yang back, breaking through what is preventing yang from coming back. So it's definitely trying to bring yang back. And I do think after great illness has resolved, it is good to build yang back up. right? With the in the dribbling urination chapter, there's a formula called Gualo Chumaiwan. And Gualo Chumaiwan is when yang deficiency, the bladder is a little bit clogged, the urine inside the bladder is a little bit warm and turbid, but it's based on a yang deficiency. Turbid, a little bit warm urine that is sticky, flowing, very difficult flow, dribbling, but based on a yang deficiency. So you have Fuzi with Tianhua Fen with Chumai. So you have the Tianhua Fen clears the heat from inside the fluid. Chumai gets rid of the turbidity of the urine, right? But then you have Fuzi, Fuling, and Shan Yao to kind of nourish the kidneys and bring yang back. And so that's why I feel comfortable using Fuzi in this formula, because the combination with Tianhua Fen has been done before. It's not like it's an unknown combination. And of course, Muli and Fuzi is a common combination too, so there's no problem. So I've used that many times and that works just fine. It's just my modification of this formula because of the absence of the other herbs. Right? So that's just a little bit difference. The reason why Dan Dong himself does not put Fuzi in here is because the illness has resolved. Fuzi is an herb that treats the illness when the illness has not yet resolved. So he doesn't put Fuzi in here because the illness has resolved. There is no more febrile event. There is no more yang deficiency that needs fixing, because otherwise he'd be fixing it. There's just a little bit of clogging of your urinary system that needs to be opened up a bit. So he's just kind of declogging, softening the water and declogging. He's not necessarily working on restoring functions. The functions have restored. You're just physically declogging a bit. So that's why his approach is slightly different. Jobeimu is also a diuretic in our system. Now again, it's a specialty herb. It's only used once. Big deal. It's one formula, Dangwei Kushen 1, which is just for urination during pregnancy. No big deal. Normally we know this herb more from the perspective of like kind of phlegm, heat on the lungs. But that's exactly what this is. Tinglizi embodies the lung-bladder relationship. Jobeimu also embodies the lung-bladder relationship. Jobeimu cools the lung, just like Tinglizi cools the lung. And what do we know about pregnant women? What do we know about pregnant women? They're hot. Not the proverbial necessarily. Not all. A lot of them are, but not all. Did I reveal a fetish? I did. I'm sorry. Did I say that out loud? Yeah. But basically, the blood is warm because they have 2 heartbeats. Right? The blood is warm, so they have. So there's more tendency for pregnant women to feel warm, have a nice, good blood complexion, like flushing, like some flushed face. They're beaming, right? They feel the muscles are more built, they're more round, and so forth, right? Because they need that blood to supply to the growth of the baby, right? That's very important, right? So, but because the blood is warm, that's why it easily can get a bit too warm, and then it warms up other parts of the body, right? And when you're looking at the layers, you've got air layer sitting outside, water layer, and the water layer sitting outside of the blood layer. When the blood layer warms up, not now due to pathology, just due to the physiology of the pregnancy, right? And some women just have more tendency to be warm, and some women have tendency to be cold. That's just constitutional. There's nothing special or weird about that. So then, the heat of the blood layer can warm up the water layer. Right? So, what happens in Shanghan, cold damage situations, when you go into a Dangwei Sinitang situation? It is cooling off of the air, cooling off of the water that ultimately leads to the cooling off of the blood. How do you warm the blood? In Dangwei Sinitang specifically, what organ do you warm to warm the blood? Dangwei Sinitang, what organ do you warm to warm the blood? Lungs, Shishin. Right? Remember, Shishin is the metal herb of the wood class of the inner circle of archetypes. Right? So you're warming the water layer inside the lungs to have a double cooker effect on the 100 vessels that converge upon the lungs to then create full body blood warming effect. Right? So Tinglizi and Jobeimu embody the blood cooling effect through the lung. Tinglizi cools the water in the lung because That's what it does. We know that. But what's the relationship with the blood then, Arnaud? Like, you just make that up? No. It treats abscess. It treats the stage before the abscess before the blood has boiled over. So it cools water layer to cool blood. Right? And it gets rid of all this hot water that is cooking your blood in the lungs. Right? That's exactly what it does. Same thing with Jobei Mu. You don't go in during pregnancy and cool the uterus directly. That would be very, very bad. Because it would be as if you're trying to treat a primary heat in the uterus, which is not the case. The primary problem is not even a problem. It's just pregnancy, which can be problematic. But that's a different story, right? It just warms up, it just cools off the lungs, and then it brings this cooling rain, this, like this little baby showering in this nice waterfall of water. He's like, like cooling off. This is my brain. It's just a glimpse into the brain of Arnaud. That's all we're doing. But that's it, right? So that you're cooling indirectly. This is the beauty of Danlongjing, because if you're cooling the womb directly, what's going to do? Contract. But what do? It's the same thing with Huashi. Huashi it cools off the lungs, and then this water, just cooling water, just flows through your body and cools off your whole body. And ultimately flushes the warm urine out of the body, and you cool off and you're fine again. Same thing with Jobei Mu. The reason why you're not using Huashi is it's called the slippery stone. And whoops, this baby just slid out. Right? You don't want that to happen because it lubricates hollow spaces. So Huashi is not the herb that you would use. Though I have during pregnancy. Yes, I know, I'm a rebel. I have, under very specific circumstances I have. And I haven't seen any symptoms or any problems with it, especially not if it's, the last 2 weeks. If you're in like week 37, 38, if it slides out, no big deal. It's not a big problem. And it won't at that point, You've made it this far, you're fine. But yes, so Jobei Mu does exactly the same effect as Tinglizi, but with not an emphasis on respiratory, but only emphasis on urinary. It does the same effect as Huashi, but without slickening the orifices. And it cools the blood to kind of calm the baby and make the urine clear again, and therefore flow better again, but by going through the lung. So that's again embodying that lung-bladder relationship. I just think that's really cool stuff. Danlongjing, his mind, he just thinks so far. Throughout his formulas, you can just see one primary principle, which is safety first. It's always like that, always kind of super diplomatic, like he's like the Condi Rice of Chinese medicine, he's like super diplomatic. That's a very bad metaphor. He's super diplomatic, right? So it's always trying to address an issue by going like 2 or 3 layers removed, and like having the effect trickle down. He's always hoping for like a trickle down effect of the positive effect, rather than just going allopathically. Here's the problem. Here's where I'm going to do the work. Like he really doesn't use that approach often. Sometimes you have to, right? But not often. So that is that. So Dangui Beimu Kushinwen, again, you normalize the blood layer with Dangui. That's the same thing. Beimu cools the heat in from the fluids, but it basically also dilutes the urine by bringing cooler water from the lungs down into the lower body. And how does it do that? By, cooling the blood indirectly. The uterus cools off, so it no longer beams and transmits its warmth from uterus to bladder. Because the reason why your urine is so turbid and warm and not flowing is because you've got this ball of fire sitting next to your bladder, called the uterus. And Taiyang blood and Jueying blood is the same blood, because Taiyang and Jueying conformations are both lots of blood, little qi. So that's the same type of blood. That embodies water gives birth to wood relationship. The warming up of the water of the north steams up and gives birth to the blood of the east. Right? That's the relationship, right? So if you cool the water, you cool the blood. If the uterus is too hot, the urine is too hot. The blood that flows through the wall of the uterus is the same blood that flows through the wall of the bladder. Same blood. So that's the mechanism. So Kushan is just going to transform the viscosity of the turbid urination, that is not flowing easily, and Beimu is going to dilute it and cool it and actually cool what it was heating it up, which is indirectly cooling the blood of the uterus through the not double cooker now, but double cooler effect of, it's like the ice bucket for your champagne bottle that you have ready for when the baby delivers. And so, right? And so that's basically the mechanism. Beautiful formula. I mean, it's basically, you can use it for a lot of things. It's basically a hot, damp combined with slight urgency of blood of the wood system. So slight blood deficiency, slight irregularity of blood physiology with some hot damp at the same time. So it could also be used for skin conditions, could be used for urinary, could be used for lower burner damp heat, whatever, leukorrhea. I mean, it could be used for a lot of things. But as long as you grasp the mechanism, then you can just, wherever you see that mechanism fail, could be all kinds of clinical presentations. Right? So that's the mechanism behind Beimu. Right? So you see here, it's used for the urination that is dribbling, the dribbling urination, right? So that's the mechanism here. But all the other things, you see the difficult lactation, isn't that what I just explained, how Shigao works on difficult lactation? Same thing. Beimu, what's the color of Beimu? White, right? Same thing. Cooling metal so that the milk is nice and fresh in the refrigerator, right? It's exactly what it is, right? Cooling the metal to cool the blood so that the drain, as the drain excretes the milk, it doesn't boil the milk. You know what I mean? So, so that everything is nice and cool. So that's the same mechanism. So that's Dangui. Beimu Kushen 1. I like this formula. This is a very, very nifty formula. It's the ingenuity is really awesome. Any questions about that?
Yeah.
Yes.
I have a question about the lactation.
Mm-hmm.
Because I see a lot of difficult lactation cases. I work with a lot of clients like that. So I was wondering how you would distinguish between if you were to use a Shurgau formula and the Dangui Beimu Kushen one, would this be accompanied by some difficult urination?
I wouldn't think of a Beimu formula as a primary formula for lactation, not in our system, right? If a person has, let's say postpartum turbid urination, no full body systemic fever, because that has to be obviously absent, because otherwise you have to use Huashen. No full body systemic fever, turbid urination that is cloudy and sticky, and at the same time difficult urination, then you just give them Dangui Beimu Kushen 1, and that will be totally fine, and they'll have abundance, and it'll flow well, and the urination will be fixed too. If you're giving them a Shigao formula, there's no urinary problem, none whatsoever. And if there's no urinary problem and there's no dry heat, then it's just a deficiency, and then you just give them a Dangui Jianzong Tang or a Huangqi Jianzong Tang or something building. Right, so it's just like that. It's simple. Yeah.
This
Yes?
is probably a stupid question,
I'm
but
sure it's not.
in Beimu, does the Mu mother have anything to do with it treating lactation and pregnant issues?
Oh. I don't know. I mean, that's kind of nice. I mean, I wish I knew about the names of the herbs.
Yeah.
I know Heiner's been trying to do research into that, which is it's kind of like acupuncture points, right? There's a very distinct reason why the herbs are called the way they're called. Why Gui has one wood but two earths, like all those things. And Heiner does a lot of research in that. I don't know if he's got systematically already figured something out yet, but yeah, so it's interesting. I don't know. I don't know actually whether it has a relationship to that. And then Bei being like the treasure, Bao Bei.
Well, a shell,
The child.
right? It's shells. So shells have something inside.
Yeah. Yeah. It's very interesting.
Doesn't this mean the Bay means it's like something of worth? It's not the shells inside that it has a.
Well, pearls are inside shells, right? Yeah. I mean, because the node, I don't really know that stuff very well, so I'm kind of in uncharted territory. But how do you write that character again? Chen, right? Right. and then the pregnant woman is Ren Shen, right? It's without this, it's Chen, but with this, it's Shen, right? Ren Shen means like the pregnant woman. So these are both heavenly, earthly branches. You see? So Heiner's research on that goes pretty deep. I don't know it, and I'm not going to try to know it because I haven't done this type of research. But this is earth, right? And this is water, right? And then I think this one is actually earth. This actually the animal is dragon. And so his research goes into the dragon. The ancient images of the dragon all have this pearl here, right? So we call this, what is it, Shuanglong Xizhu, right? The two pearls, the two dragons playing with the pearl, like these old images of two dragons. They're always playing with a pearl. So the pearl is, of course, in the bay, in the shell. There's a pearl inside, which is the dragon, which is Muli, which is all of the, so it's got this whole, boom, type of symbolic research that he does on that, which I think is fascinating and interesting. I just don't know anything about it. But that's why I'm happy he's doing it, because I don't have the energy or the skill to do that. I'm just more clinical.
He's doing a webinar today. I wonder if anyone's doing some reconnaissance.
It doesn't matter. I mean, you can just go, like if you have, if you're attached to a school, like if you're at PCOM or any other school, you can just do interlibrary loan with NCNM library, and you can get any and all of his materials, video recordings, DVDs, anything they have through interlibrary loan. I mean, this is all public domain. It's not like I've sat in on quite a few of his classes, but I've never been able to like systematically sit in on his classes, and now I can't because I'm kind of persona non grata at that school. So, it's kind of, they don't like to see me come very much. But yeah, so otherwise, but it's very interesting stuff. Like some of the findings that he's found as far as looking at, then he will look at these characters, and he will look at the characters for the herb Muli, and he'll look at, et cetera, et cetera, et cetera. And then he links it to the thyroid. I mean, he's got all kinds of interesting things about it. The only thing is that there comes a point where, how far do you want to look? Because looking in that direction does remove you a little bit from clinic. And tracing your steps back into clinic actually is not the easiest thing to do then. Right? So a lot of the students that have gone through that type of training have a tremendously beautiful mind, as like their ability to see the really beautiful things on the inside of Chinese medicine and the cultural aspects and all of the myth and lore and all that. They have very good access to that, which more than me maybe. Like I tend to think that by having lived in China for so long and reading the classics, that somehow it's also inside me. I just don't know it consciously, but they might know it more consciously. But then for them to trace their way back into clinical practice becomes actually harder. I've seen them struggle more with clinical practice, having that level of understanding. Because there's only one Heiner Fruehauf. Heiner Fruehauf doesn't struggle with clinic. He seamlessly bridges that very profound, deep, spiritual, intellectual understanding with clinic. But there's a reason why there's only one guy like him. I mean, the guy's a genius. I'm saying this on camera. I mean, it's true, right? But it doesn't mean that can be replicated. And I'm trying to teach something that can be replicated. Jingfeng, classical formulas of the Shennong style. And Shennong couldn't give a shit about this theory. It's not the divine fisher, okay? He doesn't know about pearls. He's like, yeah, whatever, right? I'm just working the field here, chewing on stuff, munching on whatever I can get my hands on, right? That's Shennong. But no, that's true. That's a distinctly different style. This is way more, it's not even Huangdi style anymore. This is Fuxi style. This is Fuxi being all shamanic and everything, figuring out the universe, which is quite removed from clinical practice. Quite removed, So that's why I'm very cautious about going there. I'm always thinking like, man, I would love to be able to understand all that, because I mean everything about Chinese medicine I love, obviously. But there comes a point where like, how much of my resources and my energy can I put into that? There comes a point where I have to just give up and say, you know, next lifetime, you know, just not this time, you know, I'm just going to focus a bit more on clinical practice. Because knowing all this does not necessarily make you a better clinician right away, which means, you know, good luck talking to your banker when you're behind on your mortgage payment. Like, but you know, let me explain to you the stamens and branches of, you know, it's, if it doesn't put bread on the table, I'm sorry, but I don't want to teach things that are not going to put bread on the table. Whatever I teach you, I guarantee you'll be a better clinician. And normally, the law of the universe should be that if you're a better clinician, people know you're a better doctor, and then people gravitate towards you and want to be treated by you. And then you make a little bit more money, and then you have a comfortable life, and that's the reward for you working so hard. I think that's just fine. That's kind of, I like that. There's nothing wrong with it, you know. I'm definitely not of the conviction of making money is bad, you know. It's good. That's why we do it. There should be some reward. Chinese medicine doctors have always been comfortable historically. They've never been rich. If you want to get rich, you're in the wrong field. But Chinese medicine doctors, by virtue of the ethics and the type of work that you do, karmically, you're sound, and right now, you're comfortable. And that's what I want everybody to also get to, you know, and so it's good. That's good. But yes, definitely, there must be something there with Beimu and things like that. There must be.
So is hernias and amassments, but it's used almost as a transformational type of herb for probably, you know, as a diuretic. But does it have some sort of breaking apart mechanism? I have a formula that I use for lipomas, and it's in it.
It's still a pungent herb.
Yeah.
It is a pungent
I
herb.
was thinking if it was breaking it apart, but now what I'm learning is why it's working is more is because it's like taking that dampness of that lipoma, which is that fatty tissue, and transforming it into water.
It takes, well, that is stagnant liquids,
Yes.
right? It's triple burner territory. So it's a liquid that has gotten so stagnant that it has become non-liquid and solid.
Yeah.
So it will render it back into a liquid state. It's a
Render it back into
it's a
liquid so you don't have
liquefying effect. Salty herbs are liquefying too. Just like you sprinkle salt on ice, it becomes water, right? But pungent herbs, it's like TNT detonation type of liquefaction. You know, it's like, right? So it's pungent. It's like dispersal to break it into small pieces. And then it also reabsorbs and liquefies
So
better.
what is the difference between like this as breaking it apart as opposed to mouli?
Salty versus pungent
Oh, it's
difference.
salty.
Yeah, mouli is salty and Beimu would be pungent. I would still put my money on mouli because salty, the main function of salty is to disintegrate hardness. That's the primary function. The primary function of pungent is to disperse and to moisten. So the softening effect of a pungent herb is secondary to what it does, while the softening effect of a salty herb is primary. So the money is definitely on
Maybe
mouli.
it would even could work in conjunction.
They do work in conjunction. There are lots of TCM formulas that have them together. Isn't like Shaoluo one doesn't have both in it? Doesn't it have the Shaoluo, or what is it called, or the Yuhu one or something like those kind of scrofula formulas? Don't they all have those combinations of mouli and Beimu in it? I don't remember those formulas. I've never even seen scrofula in my life. I mean, I don't even know why we learn so many acupuncture points that treat scrofula. I mean, like, what's wrong? How's your scrofula today? Yeah, I don't know. But yeah. But if you understand the mechanism, you know, then yeah. Cool. Let's take a break. Yep, hour and a half lunch break, and then we'll talk after that.